61, only half of the class. Okay, let's have a quiz. Sorry, I haven't get the chance to upload stuff yet in the Putra Blast because somehow the Putra Blast is down to get in, but I just got in a few minutes ago. So I got it answered. They said that database is full or something. Okay, how's our weekend? Hopefully everybody doing well. I have some flu today, so it's slightly late. Okay, before we start, do you have any question on previous class or anything at all? Okay. 74. Could I upload the notes just now, but I already shared with JJ. Okay, for today, the the lecture is still part of the sort of introduction. We are not going so much into disease yet. Okay, let me see. Okay, for today's lecture, I'm going to cover just like general principle of how you investigate diseases and how are you going to plan the flock health program. So this one applies to basically all diseases. Okay, this one applies to all diseases and sort of like all farms whenever you visit farm. Before I proceed further, I would like to ask for you, just in general, what's your general idea if you want to work in poultry? What are the job opportunities? Everybody? So quiet. Okay, so kita buka chat. No, I mean not job scope, but the opportunities. What kind of jobs can you get if you're interested in poultry? Farm manager. Vets usually are not hired for farm manager. Usually for farm manager, they will hire animal science people or DKHP people. Okay. Vaccine making, nutritionist. You're not making vaccine. Okay, unless you work with research kind of things lah, which usually under academic. Okay, senior farm manager. Maybe, but most of that they don't really hire vets as farm manager, but they do hire vets usually as technical people, and then afterward it become more like executive role, where it's not really farm manager per se. They sort of like oversee the whole company farm. Okay, you have a lot of options actually. Number one, if you want to work as farm vet, okay, we call it farm vet, means like you are in charge of certain farm only. For example, if you work with some big companies, Huat Lai, Leong Hap or something, they put you at the breeder farm. Okay, your job is to take care of this breeder, one particular breeder farm, but that breeder farm probably have like 200,000 of chickens. Okay, or you are in charge of several farms, but still under sort of like farm vet. Okay, second options is if you want to venture into pharmaceutical company. Okay, if you want to go into pharmaceutical company, usually you'll be the technical vet. Okay, you go to farms and visit farms, give services or sort of like customer service because they do like a lot they purchase your products, your vaccines, your antibiotics, your supplements or whatnot. Okay. And then you can also work in feed mill company. So that's where like nutritionist kind of thing. So feed mill company usually you in charge of the formulation of the foods, and then at the same time you may also work as technical vets. Okay, you have to visit all your clients under feed mill company. For example, some feed mill company like FFM, Cargill, Gold Coin. Okay, those are all the feed mill producing company. So what you do is you also go to farms. These farms sometimes they complain, my chicken is not growing so well and whatnot. It doesn't your feed somehow a lot of like mycotoxin and whatnot. So you have to entertain them. So you have to visit them and then see what can you help with all these things. Okay, and then you can also be a researcher. Okay. Some people, for example, if you work in Mardi or something, okay, there are people in Mardi working on doing research on ayam kampung, doing formulations also and some stuff lah. And then you can also join as academician like me. Okay, for me, I'll do the same thing. I'll do visit farms. I do clinical work. I do research as well. Academician is like sort of cover everything. I have to give talks, okay, and lecture, and then also have to do consultation. So some farms hired me or invited me to consult their farms. Okay, so it's a bit all rounder there. And then what else can you do as a poultry vet? Sometimes you may also be the executive level lah. Okay, the executive level means like you at first you started off with a technical vet. Okay, you go farms and whatnot. After several years, you at the farms. I mean, you have seen everything. So you are hiring new vets, technical vets. So you are more the executive level. You basically in the office, but you go visit farm sometimes. Okay, you do a lot of management works also. This happens also in pharmaceutical company. A lot of like vets they took MBA. In addition to that, usually if you take MBA, the chances for you to climb the hierarchy is better lah. Okay, you can cover regional. Okay, you can cover Southeast Asia, or you can cover continent kind of thing. So there's a lot of vets out there. Okay, there's a lot of opportunities for you there. Like it depends on where you want to venture. If you're interested in poultry. Okay. So for today is I'm going to give you a brief principle of disease investigation and flock health program. So what I'm going to do when you go to farm, okay, when you have a complaint on the disease or something. So when it comes to disease investigation, you have to utilize various knowledge in animal science, all the DVM1, DVM2 courses, production, veterinary medicine, anatomy, all the medicine courses, the drugs, pharmacology, parasitology, bacteriology, and whatnot, laboratory science, okay, all the lab stuff like virology and whatnot, because you have to know all this before you decide what sample to send. What are they going to do in the lab? You don't simply send. Okay, there's a lot of vets out there, and I know that they simply send stuff. Okay, this one I have a lot of differential, but I don't know what sample to send. So they literally send the whole chicken. They take everything, all the samples, all organ and whatnot. They don't know what to do. Okay, they have the general idea, so they just send everything. So if you are good in all of this knowledge, okay, so you actually know what you're doing. Okay, other related knowledge such as and skills and experience in deriving to diagnosis and also appropriate prognosis. You have to utilize all these various knowledge, and it is very essential to know and understand the host agent environment interactions and as well as pathogenesis of the disease. Okay, if you encounter a lot of things, a lot of diseases, if you don't understand the host agent interaction and pathogenesis, you might misdiagnose it. Okay, let's give you an example. For example, you don't understand the pathogenesis of ILT, infectious laryngotracheitis. Infectious laryngotracheitis are limited to upper respiratory tract. Okay, and then you take samples from the organs, spleen and whatnot. So high chances for you to not get the agent that you want. And also when it comes, for example, ILT as well, if you send for histo of the trachea, you're expected to see the inclusion bodies. Are you familiar with inclusion body? I think pathology should have taught you that. Okay, inclusion body. But for ILT, inclusion body are only seen around 5 days post-infection. After that, you might not see inclusion bodies anymore. Same also with IBH. Okay, IBH, inclusion body hepatitis, that happens in chicken. So you have to understand the pathogenesis. If you don't understand the pathogenesis, you take sample 1 week later and then you do histology and you say, oh, there's no inclusion body hepatitis, so this farm doesn't have disease. So there are chances for you to misdiagnose is high. Okay, you have to know all of these things. Okay, you have to understand about disease. There is a balance. Okay, it's an equilibrium of pathogen and host. So when the pathogen factors are the pathogenicity, the virulence of the pathogen, the number and the amount of pathogens, and the type of pathogens. For example, or whether the pathogen is highly virulent kind of things. The strain is different from the previous strain. For example, like COVID lah, the Delta strain, the Omicron strain, all those things, the type of pathogens, and the poultry itself, the physical condition, the host, specific and non-specific defense mechanism. So let's take an example of COVID situation. Okay, most of the time all of you young people, when you get infected with COVID, high chances you are in level 1 or level 2 stage. Okay. Plus, if you are vaccinated, so means your defense mechanism is higher. So the host, okay, the host protection is better. So the pathogen cannot overcome the host pathogen. But sometimes, okay, if you have a lower defense mechanism, for example, you are immunosuppressed or you are obese or you have some underlying condition, for example, heart, diabetes or high blood pressure and whatnot, and then the pathogen itself, okay, maybe you get infected with the Delta one, the highest strain. So the balance will not be on balance anymore. So it lies towards the pathogen. So that's when you get the disease. If you are heavier on the host condition, man, the chances for the pathogens to cause disease is less. Okay, so you have to understand the equilibrium because not every time you get infected you will get disease. There's a lot of time you get infected but you don't have disease. For example, like COVID as well. Most of you, I'm pretty sure, me myself, all of you has been infected at one point of your life without you knowing. It's like you don't test every day, right? Okay, you may have been infected because you are healthy, so you're not showing any clinical signs at all, not even fever, not even anything, but you might spread the disease to others. So that's why I said, and then we are moving towards endemic. Okay, in April. Okay, these are the factors that contribute to the disease. Okay, one is hereditary. Certain disease. This happens in Marek's disease as well. Certain line of chickens are more higher chances of getting the disease, or the sex of the animal as well. Some gender are more prone to certain diseases, and then infections of the disease. That one is quite straightforward. And then management plays a big role as well. Usually, those farms that have recurring diseases, okay, usually are those farms that with poor management and biosecurity. And last one is nutritional factor. Okay, if the host did not get enough nutrition, you will contribute to certain diseases, especially nutritional diseases. Okay, when you want to do in disease investigation, so general diagnostic approach as for other farm animals or pet birds as or pet animals as well, you have the flow is almost the same. So number one is you do history taking. Okay, you ask literally everything. I think you have learned history taking last semester in 3612. You even have OSCE for it, for history taking. So that's how you do history taking. You have to have a thorough history taking. You have to ask literally anything. If you go, I go farms a lot of your seniors also have problem with history taking. Maybe it's a bit different. When I was in US, I taught US students. Okay, when I do my PhD, I do teach some classes. Okay, for the vet students over there, they are more outgoing. They outspoken lah. Okay, they don't have problem with talking. Okay, it's like this class. Whenever I ask question, very quiet. Okay, so it's a bit different. Maybe they're a bit older because in US, DVM is a second degree. It's a second degree. Means like you have to have another degree before you do DVM. You have to have degree in biology, in marine, or in animal science or something. I have my office mates also. She did PhD first. After PhD, then only she do degree. So the vet students are a bit older. Okay, and next after you do history, you do clinical. You assess the clinical signs, and then you do physical examination. Okay, after that you proceed with necropsy. This is for poultry. Poultry in specifically for pet birds, you don't do postmortem. Okay, you do check on the gross lesions, and then you take sample, you do microscopic lesions, and generally from gross lesion and microscopic lesion, you should have a general like tentative diagnosis. Okay, and then after that, you confirm with laboratory test, and then that's how you have the confirmative diagnosis. Sorry. Okay. When you want to do diagnosis, a lot of things you have to ask. Is there anything wrong? What is wrong? What is the most likely cause? And how can I confirm my diagnosis? This should be the question should be in your head when you are trying to do diagnosis. So, is there anything wrong? So, what you have to check is, okay, you have to check the production parameters, the increase in mortality, the clinical signs, and the gross lesions. Okay, these are the things that you want to say. Okay, you have general idea if there is anything wrong. This is an example of egg production cycle, egg production graph. Okay, chart. Usually they increase around 30 weeks is the peak production, and then they gradually go slower. This is the general chart lah. Okay. But if you see the chart, okay, you ask them, can I see your egg production chart? And then suddenly there's losses here, okay, a big drop here or something, means there's something wrong at this particular part. Or you go to the farms, usually the farm have this kind of like chart, okay, on the wall, on the each room. Okay. This one of the contract farm, Kisong. Okay. You look at this chart, usually they have almost similar chart. It's like this one. Tarikh, the umur, the dead one, how many you cull, and then these are the foods and the vaccination or something you write there, and then this is extra comment. So you're looking at this chart, for example, it's okay, 2, 3 dead or something, and then starting at day 16, you see here, okay, 20, 40, 50 died, this one around like 50, 60, it goes higher around this area. So your investigation should start somewhere. You have general idea, it starts here. So you want to ask again the farmers, what has happened just right before here? Did you vaccinate them? Did you have any visitors to the farm? Did you change the feed? Okay, and is there anything new at all? So you have to have the general idea. What are the clinical signs when they started? So you have general idea when you want to do diagnosis. Okay, because we have a case before, a big layer farm. Okay, they have a visitor, a vet. Okay, technical vet came visit. This technical vet usually visit from farm to farms. Okay, and then one day the technical vet visited the farm, and then somehow did not shower. Usually you have to go shower from especially layer and breeder farm. You have to take out all your clothes, and then you have to enter the mist, the disinfectant mist. Okay, you walk around that, okay, on the mist area, and then on the other side of the farm you have to shower and put on their clothes. Okay, but this particular vet caught on CCTV, so they walk around. Okay, they walk around, go behind, and then tukar baju je. So you can detect. So the vet has a big to answer after that. Okay, and then you look at the morbidity and mortality chart. Okay, usually you should have in broiler, usually you have high mortality during the brooder period. Okay, and it shows it goes normal. Okay, so epidemiology is one of the things that you should know. that is a study of distribution and determinants of health-related states or events. So endemic it means like it's always present in an area. Like we are trying to declare now of COVID. So COVID has become like dengue. Okay, you have to control it case by case basis. Okay, is we are not going into lockdown or anything anymore. We have to accept that it's everywhere. You cannot control it anymore. And second is epidemic occurrence in an area where it doesn't usually occur or at higher than normal level in an endemic area. Or pandemic like COVID lah, occurring in wide geographical area, usually involving several continents. And we also have exotic or foreign, not usually occurring in particular geographic region. So exotic or foreign usually go country case by case basis. For example, velogenic Newcastle disease. In US, they call it the exotic Newcastle disease because they don't have that strain in US, velogenic. But in Malaysia, it's very common. You don't call it exotic anymore. It's endemic. Okay, so exotic goes by case basis. For example, in Malaysia, I would say we also have some exotic diseases that you don't usually have. Okay, so those are the things. And sporadic occurs occasionally in an area. For example, like Newcastle disease or IB, it just sometimes it's quiet, sometimes it happens. If the biosecurity is not good, then it happens. Like leukocytosis or something in certain area like Kedah or something. Okay. So you have to understand also how does the problem persist in the farm. When you have a problem at the farm, you have recurrence of the disease. You have to think of the chances of the reservoir of the disease. Salmonella, for example, can persist in rats. So if you go to layer farm or grandparents stock or parents stock, the much higher level of chickens, okay, they really do a high level of rat control because they don't want to have this salmonella problem. Okay, they even put the mouse trap outside and inside, all over the wall. They have like this electric wire. Because they said if you give drugs or something, they can be resistant to drugs. But they said I've never seen a rat resistant to electric yet. They just die. Okay, so fowl virus persists in mosquitoes. So as long as you don't control the mosquito, the farm will keep occurring has fowl virus. Infectious bacil disease persists in beetles, and infectious bacil disease is also highly resistant virus. Okay, so it can persist in the environment for quite long. West Nile virus persists in wild birds and mosquitoes. So you have to understand this reservoir when you want to make a diagnosis, the story out of it. Okay, resistance of agent in the environment is also something that you have to consider. Spread of the disease is the problem spreading between animals or between animals and human. Okay, the spreading among chickens within the same farm, spreading among farms, spreading interspecies. Okay, chickens to other animals or chicken to human zoonosis. This is also important when to determine the source also. For example, if you have a problem that is limited to one farm, okay, one farm or one house, so it's most likely the chances is the issue is related to the house management, okay, house management or farm management. But if you see the disease that spread a lot of farms, okay, inter farms, and then you have to figure out all these farms, what are the similarities, what are the common thing. Okay, we have a problem before, so you have to find the common thing to all these farms. And then there's one time I figure out all the chickens, okay, receive from the same breeder farm, from the same hatchery. So the chances that this disease are vertically transmitted or the disease spread in the hatchery area. So those are the things that you want to investigate. How is the disease transmitted? Okay, so that we do have vertical transmission from parent to chicks, horizontal transmission at the farm level, and then genetic transmission. Okay, there's some disease have genetic transmission. This is an example of ALV. They can transmit through all three. Okay, if once they are infected in the farm, they can infect one chicken to another in the farm through horizontal transmission and close contact. They can also be transmitted through vertical transmission, And then some diseases also have, especially this disease, have also genetic transmissions. So these are something that you have to understand in all diseases, whether that disease have horizontal transmission or vertical transmission. If any disease that have vertical transmission, you have to solve the issue at the breeder problem. For example, when I'm talking about avian leukosis, okay, avian leukosis, they are well known to have on vertical transmission. So the way of curbing the problem or controlling the problem is you have to cull all your breeder farm or all your breeder chicken. Okay, so that all the chicken do not have the thing. Okay, horizontal transmission, for example, Marek's disease, they spread, or Newcastle disease, they spread through close contact. So you just control at the farm level. And then you look at the clinical signs and external lesions. Chickens or animals will exhibit a lot of signs when they get sick. Okay, usually they they have a very general signs. Okay, they just weak, ruffled feather. They look dirty. This one dead already. The torticollis, the uniformity issue, neurological signs, swollen of the wattle and the comb. Okay, paralysis, and this one is also uniformity and joint issue. Okay, so when you want to determine what is wrong, it's a detective work. You have to gather all possible information, observation of the environment, observation of the animals, of questions to the farmers, necropsy of the dead chicks and animals, and then you come with the tentative diagnosis to make an immediate solution. And after that, you confirm diagnosis based on the laboratory findings. Okay, what to look for in the environment or in the farm? You walk around in the farm where you have to check where is the farm located. Do they have a farm nearby? Because I've been to a farm that the owner have the same farm, okay, next door, next house is a pig farm. Okay, it's the same owner. So they took care of two farms. So you have to consider some diseases that can be transmitted from pig to chickens as well. Okay, nearby farms or road, the biosecurity, whether do they have fences, visitors, rodders. You look at the farms. Okay, if you see a lot of farms, they also have any other animals like dogs and cats or whatnot. And then the farm have a very low biosecurity. And then when you go to the farm, you see a lot of chickens showing respiratory signs, swollen face, and swollen waters and comb or something. High chances they have Pastorella maltosida because the cats and dogs can be a carrier without showing any clinical signs. Okay, so all those things. And then you check inside the house, the litter and the air quality, the temperature control, whether the house is one age or multi-age, the density of the animals, male to female ratio. Okay, you have to check also. Sometimes it's not all diseases are always infectious disease. Many diseases are due to management issue. Okay, they are panting, they show some respiratory signs, but it's not because they are infected with virus or anything. It's just that the air quality is bad, the ventilation is bad, and then the density is too high. When you have a very high density, they produce body heat. All the big chickens, all the fat one, before harvesting, they produce body heat, and also they defecate a lot because they eat a lot, so they poo poo a lot, and then all this poo poo they produce ammonia. Okay, ammonia can cause ammonia toxicity. They can show respiratory signs. Okay, location or type of drinkers and feeders also one of the things you should take note. Like I said, also many of the thing are management issue. I've been to farms that they complain that they have uniformity issue. Okay, and then when I check the farm, they have the drinker level or feeder level. They follow the big birds. Okay, okay, they like hanging, right? Okay, they follow the big birds. So usually the small one, they cannot reach all the drinker and feeder. What can they do? They can only feed whatever left over on the floor only. So that's why the smaller gets smaller, the bigger gets bigger. Then you have a uniformity issue as well. And transmit of people and tools between farms is one of the way diseases can enter farms. In addition, the following may provide more focused but useful info. Age groups. Okay, a lot of diseases are limited to certain age only. Okay, like, and some diseases are also have age resistant factor. Older birds do not have this disease. Okay, or smaller birds do not have this disease. For example, like Pastorella maltosida as well. This is only limited to much older birds. Okay, 8 weeks and older. Okay, that's why you never see this kind of diseases in broiler chicken, because broiler chicken they only live like for 4 weeks. Marek's disease or lymphoid also is a disease that infecting much older birds. Okay, so you don't see young birds. Okay, so these are the factors. And management system, whether they are slatted floor or deep litter system. Okay, slatted floor usually have fly problem. Deep litter system usually have a coccidiosis problem, because slatted floor, they when the chicken defecate, they goes down under the floor. Okay, but deep litter, they defecate and then they defecate on the floor, and then the chicken have access to the flooring as well, so they can actually consume some of the litter when they're taking foods on the floor. So there's other things. Open versus closed house system. Open house system usually have heat problem as well. Okay, because it really depends on the temperature. Closed house system also have heat problem if your ventilation or the fan doesn't have is not enough. Okay, or your density is too high. Open house system are more prone to a lot of diseases, because especially the aerosol type of diseases, because disease can just enter through the wall. Okay, and then also self mix or commercial feeds. This one is related to nutritional issue. Okay, usually if the chickens are fed with commercial feed, I rarely see nutritional problem, because usually formulation of commercial feeds are quite well done properly. Self mix. Okay, some farms they self mix their own food, or backyard chickens sometimes they give leftover foods. Okay, leftover food, makanan-makanan lebih daripada kantin or something. Yes, and then you may see like nutritional issue at the farm. Okay, this is an example of backyard farm that I've been to, located in Beranang or something. Okay, this backyard farm, they have like few thousand farms like this. Okay, and then they built this house, they built himself for this open house system. And then at the middle here, they have another small house. Okay, they said this is the sick bay. All the sick chicken I put in the middle here, which is I'm not supposed to do that. Sick chicken should be placed far, far away, not in the middle of the farm. This will be the spreading center. Okay, and then you can see when I visited this farm. Usually, this farm shows swollen face, caseous material in the face and whatnot. Usually, they are infected with Pasteurella matosida, because this farm also there's a lot of like angsa lah, kucing lah, tikus lah, semua ada. It's an orchid. Okay. Foot bath also. I went to some of them there. They have foot bath. Just cukup syarat je. They never change the water also. So sometimes I would consider like dipping your feet because your feet to get dirtier than not dipping it. Okay. And reuse of litter. This is a practice also. But reuse of litter is something Malaysia, we don't do reuse of litter. Okay, because we have a lot of cheap labor to scoop up the litter every cycle, and then a lot of like wood shavings. However, in US, okay, they do reuse of litter, wood shavings, for 5 to 6 cycles. And then you may see a lot of diseases like Marek's disease, for example. It's difficult to control. They get infected at day one. Okay, the moment they put a chicken, the chances of chicken get infected is higher. And then they use dia punya lantai tu kalau dekat US tu dah jadi macam simen dah. Okay, dia dah keras dah. Okay, because it's 5, 6 cycle, they want to save on the cost. Okay, not in Malaysia. So what you look for in the birds? What to look for in the birds? Usually, when you go to the farms, you can listen to unusual noises. What I do is, okay, when you visit the farm, enter the farm very quietly. Don't simply buat noises apa semua. Enter the farm quietly. Sometimes I enter them early in the morning. Or if you're a farmer, you can enter them at night also. That's when they're actually relaxing and sitting down. Okay. And then that's when you can actually detect all unusual noises. Kalau you masuk and then buat bising, you jalan-jalan-jalan terus, they get panic and then everybody make noises everywhere, and then it hides, it masks the unusual noises. So what I do is usually I go to farm if I go alone. I enter the farm and then I sit down, squat for a while, let the chickens like get familiar with me, and then just observe them for 5 minutes or something, and then listen. You will hear some noises like they sneeze and they cough. Have you heard of chicken coughing? Of sneeze? They sound like human also. That cough can be like like that, or reels. Yeah, it's from their nose, like something like that. So you have to actually listen to them. You go near chickens that are weak or sitting down or recumbent, go near them and then sit down next to them. You listen to them. Okay, I don't have video. I visited some farm that have like quite loud noises that was infected with ND or something, swollen face. Sick chickens are found normally along the walls, cornered and below the drinkers or feeders. And then you have to observe the chicken whether they are doing normal activity or normal mobility. Unusual look, you observe through clinical signs and external lesions. So you have to question the farmers. What breed of the chicken do they have? Okay, if you know the genetic line or something, but not always lah. Most of the time, genetic does not play the role. The age of the chickens. Okay, what age is it now? And then you should know at certain age, okay, they should have this vaccine already and whatnot. And then sex of the chicken. Okay, but do not ask sex of the chicken when you go to layer farm. I've been to layer farm with students, and then the first thing they ask, cik, ayam ni ayam jantan ke betina? Dia cakap dia ke dia ni layer farm. Layer farm is all betina lah. Okay, ada ke jantan bertelur? Okay. Okay, and then you have to be nice to farmers also lah. This one is I cannot emphasize enough. Okay, because this is more like a social kind of like thing. Maybe you are in a pandemic situation or something. You never see farmers. Ni saya bawa kadang budak-budak rota masuk-masuk. Busuknya farm ni. Depan-depan owner dia cakap. Okay, so you have to mind your words lah when you are dealing with farmers. When the problem started, okay, when you have to ask the farmers when does the problem start, few days ago, 1 week ago, what have you seen during when it started and whatnot? Have you seen this before in this farm? Because high chances a lot of diseases are recurring diseases. You hear noises, background noise. How the problem started, male or female only, is it one house, is it one farm, or regional, company wide? Okay, that like I said just now, it could be a vertical transmission kind of thing, hatchery problem or breeder problem. Okay, if just one house, then it's limited to that house only lah. Okay. So question to the farmer, anything new or different in previous weeks when it happens? New batch of feeds, medication, vaccination, new crew for vaccination. Okay, this is one of the thing. If they have a new staff for vaccination, usually they do a lot of like bad things. Okay, they are still noob. Okay, newbie. So for example, if they do subcut vaccination, instead of subcut, they inject into the muscle or into the neck, you will see a lot of chickens after that have torticollis. Okay, that could happen. Okay, introduction of new males into the farms or new chickens into the farm or something, and then you have to overview the vaccination program, whether they are doing the vaccination program, and then when was the vaccination being done, how they do it and whatnot. Because sometimes they said, like I said in the previous class, they claim they have vaccinated the chickens. Okay, but does not mean they actually immunizing the chickens. Some farmers may not do the vaccination program properly. They did not put ice. They didn't finish. Because I've seen farmers, actually banyak farmers lah yang ni. I've seen farmers like vaccine that I show you in the vial. After you dilute it, if okay, it's for 1,000 dose. Even if you have 500 chicken, you cannot keep another 500. Dia katalah dilute ni sebab saya ada 500 ekor je. So dia ambil separuh, dia bagi ke ayam, lepas tu separuh lagi disimpan dalam peti. That's not how it works. Okay, the moment you dilute it, the virus die within 2 hours. Okay, the next batch that you give, actually you give water only. There's no more vaccine anymore inside there. Same with COVID vaccine also lah. Okay, siapa ambil Pfizer apa semua tu, dia datang dalam batch tau, 6 orang. When they open tu, satu vial tu untuk 6 orang. Kan ada satu group kan, siapa yang buat vaksin tu. Okay, ni group A, group B apa semua tu. Kalau tak cukup orang, dia tak akan bagi vaksin tu. Sebab nanti membazir. Sebab once open, that's all. You tak boleh simpan balik. Okay. And then one of the thing when you ask question to farmers or to workers, you have to listen to them carefully. Okay, don't uh, take it literally. Okay, sometimes they might be they're masking the what I call it the original thing. Okay, what they, especially if you ask workers lah, workers hari ni you bagi makan macam mana semua, semua okay, semua okay. Okay, so workers usually especially in front of the owners, they kata semua okay. Okay, so you have to listen carefully. They might have not done it properly. So usually what I do is kata, boleh tahu tak macam mana you buat, macam mana you dilute the vaccine ni, you guna ais tak, berapa jam you bagi, apa semua tu. Nak tengok masuk, okay, you have to listen to them carefully. You cannot apa tu, believe everything they said because it's like you're going to doctor lah. Okay, you're going to doctor, doktor tanya soalan apa semua. Ini sakit tak, pening-pening ke apa ke? Kadang-kadang you over exaggerate or sometimes you want to hide your sickness. Tak sakit, okay je, okay je. Okay, especially sickness that is embarrassing to you or something lah. Okay, you don't want to tell the doctor. So it happens also to farmers as well. Okay. Necropsy is the single most important diagnostic procedure. After that, after you do history and whatnot, physical examination, you do necropsy. It's the most single important diagnostic procedure for poultry. You have to include dead birds and sick chickens. Every time I go to farms, I always like do necropsy or some birds. If they have problems, then I do a lot of birds. If the farm is doing well, I just do a general necropsy. I make some chickens, they look weak or dead chicken on that day, and then also some the healthy ones. Okay, cull them and then do necropsy. Do a complete and thorough and systematic. Look at everything, all the systems. Keep your mind open. Do not look for any particular lesion. Okay, this happens to a lot of vets also. Okay, they have preconceived perception on certain diseases and diagnosis. Dia tengok je, swollen face biru ni, Newcastle disease ni. Okay, and then when they do postmortem, they only look for Newcastle disease symptoms only, and then come to farmer. Okay, Newcastle disease. Okay, so it might not be the accurate diagnosis because the chicken could be infected with a lot of other things as well. Okay, you have to keep in mind the chickens can be co-infected. We have a lot of cases, usually they co-infection. They can get infected with infectious bursal disease. That's why the vaccine didn't work, so they get Newcastle disease. If you check the liver, maybe the liver also have IBH or something. So keep your mind open. Okay, you don't go straight jump into conclusion the moment you see the clinical signs. Okay, you have something in tentative diagnosis. But still, you have to consider other options. Yang ni pun still possible, still possible. Let's rule out one by one. Okay, and record everything that you do. This is the stages of diagnosis. You do a differential diagnosis. After you go to farm, you check the clinical signs, you open the chicken, you should have a differential diagnosis, a list of diagnosis that correlates with the signs and the lesions that you see. And out of all these signs and lesions, you consider one or two to have to be the tentative diagnosis or presumptive diagnosis. High chances based on this lesion, they have hemorrhages here, some lesions here. High chances this is this IB, this is ILT or something. Okay, but not all cases you will have tentative diagnosis. In many cases, they just look so general, you cannot have tentative diagnosis at all. So you will end up with only differential diagnosis. And then after that, you need to confirm your diagnosis by sending the samples to the lab to find the definitive and confirmative diagnosis. Tentative diagnosis is the most likely problem. What are the most common diseases in the species, age, gender, and etc.? What commonly cause these clinical signs are what main tissue or system are affected? What is the most common in this region? What diseases are currently occurring? For example, if I go to farm, I see hemorrhages, mati banyak-banyak. My most likely at the moment is Newcastle disease. Because currently Newcastle disease has been affecting a lot of farms nationwide. Okay, banyak farm tengah mati. Okay, but does not mean they cannot get infected. It could be AI also. It could be IB also. It could be any other respiratory disease also. It just my tentative is ND. You can tell, high chances ND ni. Tapi saya kena confirmkan dengan lab test. Okay, consider the most common, but keep your mind open. And then you have presumptive diagnosis and final diagnosis. Presumptive diagnosis is most likely based on epidemiological, clinical, and necropsy data. Final diagnosis when you confirm the etiology based on your lab result, PCR ke, isolation ke, histology ke. Okay. When is it necessary to confirm a diagnosis? Okay, this is one of the things that you have to keep in mind also. For poultry, Okay, it's not always important to confirm a diagnosis. Is sometimes we only end with differential diagnosis. Okay, because like broiler, they only live for 30 days. Okay, they only live for 30 days and then you datang ke farm tu, umur pun dah 29, 28 hari or something. And then you kata, oh bukan dia banyak mati apa semua ni. You kata, ni kata, is it necessary for you to confirm diagnosis? Because whether you like it or not, okay, the chicken will be harvested in few days. Okay, by the time you dapat result pun ayam semua dah tak ada dah. Is it important to confirm a diagnosis at that point? Kata maybe you just end up with differential diagnosis. Okay, sama macam when you go to a doctor. Okay, tak adalah tiap kali you jumpa doktor, dia akan, okay, ini ni kita buat ini, kita buat X-ray, kita check untuk kanser apa semua ni, possible apa semua ni. Tak adanya. The first kadang-kadang you datang pening kepala apa semua tu, dia kata, okay, ambil Panadol dulu, ambil ni dulu, lepas tu we see how it goes. Kalau okay, okay lah. Dia tak adalah terus jump terus nak buat lab diagnosis apa semua kan. Okay, unless it's very severe or something lah. You nak ada lump ke apa ke, and then you do like that. Same as chickens also. So you only confirm the diagnosis when number one is a reportable diseases. You suspect is avian influenza, for example. Oh, yang ni kena confirm. Tak boleh suspect, tak apalah, buat tak tahu je. Okay. Number two is liability issue. Liability issue is related to what you call it, something, someone have to be responsible of the disease. Okay. For example, the vaccine didn't work or the feed. They sometimes when it comes to diagnosis, they are blaming each other. Okay, especially broiler farm. Dia kata, ni anak ayam tak cantik ni. Or dia kata, ni sebab vertical transmission lah ni. Or this is due to vaccine didn't work. So there'll be it you. They're blaming each other. Then you have to confirm diagnosis. Okay. Diseases that requires eradication as a way of control. Okay, this you must confirm the diagnosis. Because you cannot simply eradicate things without confirming it. Okay, you will cause a lot to the farmers. A lot of diseases that requires eradication, for example, like reportable diseases also lah, or in fact, leukocytosis also. Okay, it is not possible to confirm the tentative diagnosis by epidemiological, clinical, and pathological data. Okay, sometimes like I said, if you open the chicken, you buka gross lesion apa semua tu, so general, tak ada, no idea at all. You cannot even come up with a tentative diagnosis. Okay, the chicken look normal, or sometimes the very look general, hemorrhagic here and there. You cannot give a tentative diagnosis. So you may want to confirm the diagnosis. Okay, prophylaxis depends on identification of the pathogen. This is, for example, if some diseases require certain types of treatments. Okay, certain type of treatments, then you need to identify the agents. Okay, or you want to do antibiotic sensitivity assay or something. Keep in mind cost versus benefits. Okay, many farms we go, kita cakap, nampak banyak mati, tak apalah, kita macam ni, kita start with antibiotic je. Okay, because doing a diagnosis is expensive. Satu PCR tu RM200. Okay, kalau ELISA murah sikit lah. Tapi still, it cost to the farmer. So you have to keep in mind cost versus benefits. Okay, so farmers usually not willing to pay much on the diagnosis unless big companies. So how do you confirm diagnosis? Number one is histopathology. Is normally the first step for a final diagnosis. Your collection of samples at the necropsy and then send to the laboratories. What histopathology can tell us, we give us a diagnosis sometimes. Sometimes you look at something, they have pathognomonic lesions. I think you should know the term of pathognomonic lesions. Okay, like all the inclusion bodies or something. Nampak benda ni, confirm ni, memang ni, for example. But not always the case. Okay, sometimes histopathology will not give you a lot of like idea. Tell us what type of problem we have, what to do next also, histopathology. And then another one is like other laboratory diagnosis. If you suspect it's management problem, normally you do not require further tests because you boleh nampak through management issue. You just ask them to correct their problem management issue. Nutritional problem, you suspect a nutritional problem. You want to do feed analysis, too much or too less or something in the feed. Toxicological problem, you do a toxicological analysis. If you have infectious problem, you can consider do serology, isolation, identification, or molecular techniques. If you suspect a parasite disease, you do fecal exam, flotations for coccidia or something. Cytology and histopathology may reveal the parasites inside the body and characterization of the parasite if needed. And in many cases is multifactorial diseases. This is quite complicated. Okay, sometimes they got co-infected with a lot of diseases, so you have to consider be smart in doing your diagnosis. So these are things for collection of samples. Histopathology, tissue in 10% buffered formalin. Feed analysis, you take sample of feed in plastic bag, dry and cool conditions. Toxicological analysis, frozen tissue or intestinal content. Water, feed, litter in plastic containers, dry and cool conditions. For infectious disease, for serology, of course, you take blood sample. How many to take is depends on what disease you suspected. Agent isolation identification depends on the agent, blood, choanal or cloacal swab, fecal material or tissue or tumors. These can be used on depends on the agent lah. Okay, like I said just now, if you want suspect mycoplasma, you have to take from the choanal slit. Okay, if you suspect Newcastle disease, you want to take fecal material. If you suspect Marek disease, you want to take from the tissue or tumor. If you suspect certain diseases, blood parasite, then you take blood. So it depends on what is your differential diagnosis and tentative diagnosis. Molecular technique depends on the technique. What technique you want to do lah. Kalau PCR ke, ada ke. Okay. These are the tests of serological assay. Agar gel, plaque agglutination test, virus neutralization test, hemagglutination inhibition, and ELISA. Okay. And we also have molecular technique, PCR, real-time PCR, reverse transcriptase PCR, real-time PCR, immunofluorescence, and immunohistochemistry. Okay, you have to get familiar. What are the serological assay? What are the molecular technique? Okay, these are very important, especially for your CE later. Kalau orang tanya, okay, terus nak tanya, okay, hantar for molecular technique. Okay, name me some disease, some molecular technique that you can run. One, name some serological assays. So these are the important stuff for you later. And then interpretation of results. You have to be careful of the interpretation. What does that mean biologically? Okay, if you see serology titer is high, what does it mean? It could be from vaccine. It could be from infection. Okay, if it's negative, is it a true negative? Viral diseases. Okay, for example, maybe it's negative, you cannot isolate. Dia tak boleh cakap, oh, dia tak ada, diorang tak infected by this virus. Okay, maybe the acute phase is already over, so you may not get the virus anymore. Okay, bacterial diseases. Okay, chickens were treated with antibiotics. And then 1 week later, you datang ke farm tu. And then you do isolation. And then you tak boleh isolate the bacteria. So I cakap, bukan penyakit ni. It's not that. Because maybe because the bacteria already died because they have been treated with antibiotic. But does not mean the chicken does not have the disease before. If positive, is it a true positive? Some viruses are always there. For example, Marek's disease. Getting infected by a disease does not mean the chicken have infection. Let's give you an example. Most of you probably has been infected by herpes virus at some point of your life. Okay. Some of you maybe has been infected with hepatitis virus also. Okay, when you eat bad food, pasar malam apa semua tu, you may get hepatitis A. But does not mean you have hepatitis. Okay, your serology titer you will have the serology titer, but does not mean you are having hepatitis because hepatitis A usually the waktu tu je lah. Okay, unless you pergi India or something, they have different strain. Okay, can the test differentiate between wild type pathogens and vaccines? Okay, this one is also true also. So sometimes the serology titer, like I said just now, you have positive or PCR, you have positive. Maybe your test is detecting the vaccine strain or vaccine titer. Okay, so you cannot really say. So you have to, the interpretation of the result have to be slightly smarter. You have to understand the nature of the disease and the nature of the your immunology. Your immunology must be quite good. Okay. Okay, this is an example dan habis masa dah ni. Diagnosis procedure example. Ini boleh baca sendiri kot. Blah 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 blah. 26 old cage layers had a sudden onset of severe respiratory disease. Only one house is involved on this multiple house complex. Mortality was normal until today. This morning, 250 birds was found dead. Morbidity is 10%. All affected birds are in the middle of the house. The clinical signs are slowly spreading from this focus. Clinical signs included expectoration of blood, stained mucus, gasping for air, and virulent head shaking. This flock was vaccinated with a combination of NDV, IBV vaccine at 2, 4, and 12 weeks. Bigs were trimmed at 8 weeks. They also been vaccinated with ILT, pox and avian encephalitis. LT was given again at 15 weeks of age. So this is layer. Okay, no wonder they have a lot of vaccination. Also, these clinical signs, 12 chickens were presented for examination, gasping for air. Okay, this is how usually chickens gasp for air. Usually they extend the neck. If you go to farm, if they have a respiratory issue, you see all of them gasping for air. They look up and then inhale deeply. Tracheal lesions were evident in all birds. 12 blood pseudomembranes in trachea or larynx. And then some birds have mucocaseous tracheal core, sinusitis, nasal discharge, and conjunctivitis. So when you do postmortem, this is your finding. It's hemorrhagic, and then some caseous material dekat muka pun sampai berdarah ni. Okay, important information, only one house involved. Okay, it's slow moving. Dia start pada tengah, lepas tu dia spread. Blood stain tracheal mucus. And you have to consider the vaccination history also. So from this, can you make a story out of it? Only one house infected. So what could be? Is this something that is farm-wide? Okay, maybe something that is limited to this farm only. Maybe the management of this particular house only is slow-moving, blood-stained tracheal mucus, and vaccination history. So from there, you have differential diagnosis, infectious laryngotracheitis, avian pox, gastrotracheal core, and avian influenza through tracheitis. You can also have some Newcastle disease IB also lah if you want. The tentative diagnosis here is quite obvious from the caseous material and blood in the trachea is infectious laryngotracheitis. But you still have to confirm and rule out others also. Okay, so I sent for histopathology, virus isolation, and PCR. Avian pox, you can do histopathology and virus isolation. Avian influenza also can do virus isolation and serology. Kalau kat Malaysia, serology is enough lah. Okay. So from here, okay, actually a lot of stories from here. Kalau nak buat story lah actually. It's slow moving. This ILT disease is one of the disease that happen due to rolling reaction. It's due to vaccine strain. Beritahu nanti I cerita kat you lah how rolling reaction works. Okay, slow moving and then start from the middle of the house. Okay, dia kalau disease selalunya dia start kat depan house lah sebab dia masuk tempat orang masuk. Orang masuk, so that's where all the chicken get infected first. Kalau start in the middle, this is due to rolling infection usually. Dia panggil, tak nak cerita lebih sebab masa dah nak habis. This is due to vaccine strain converted back to become the pathogenic strain. Okay, because what do you call it? Vaccine, especially the live vaccine, I told you before, if you want to attenuate a vaccine, you isolate them in the host that is not familiar to them, cell culture eggs or something. Then you do in cell culture, they become weakened over time. And then the virus can gain its virulence if they call it back passage. They get infected in chickens and then they spread in chickens. They call it back passage. From one chicken, lepas tu chicken tu tak pernah infected, the chicken, another chicken, dia dapat balik the original strain yang before the vaccine become attenuated. So that's why yang tengah tu yang kena. Sebab dia rolling ke arah sana. The chicken yang tengah tu kena dulu. So that's how it works lah. Okay, so this usually happen in ILT. So that's why not all diseases. Okay, ILT. I think you have class after this. So I think I stop here. I can continue the disease control in the next class, alright? Because this one will take quite some time. Okay, probably 50 minutes. Okay, do you have any questions so far? Pathology class, is it after this? Okay. Doctor, about attendance. Saya ni pun putra belas. Kena buat tadi. Lepas tu dia betul, tak buat lagi. No worry about attendance lah. I'm not the type that worry much about your attendance because you are adult. Okay? You are already an adult. And then I would say if you did not come to the lecture, most likely you will not do well in the exam also. Okay? Because most of the question is not something in the notes. It's something that I say. Okay? So that the case, the problem was when I say is So in that case, the problem was the vaccine itself. Yes, the problem was the vaccine itself. Okay, vaccine is the culprit there. Sebab tu kalau dekat US, or Malaysia also, you if you want to do vaccination against ILT, you have to make sure your vaccination was done properly, and also uh, if not necessary, you don't vaccinate the chicken. Okay, because it can revert back to virulence. Okay, it's 10 o'clock. I think you have to go to your next class or the next lecture nanti. Okay, see you guys. Bye bye. Have a good week.